A new study highlights potentially dangerous interactions between herbal supplements and prescription medications. Researchers looked at dozens of reports of serious drug interactions among patients with disorders like high blood pressure, diabetes, cancer, and depression, and they found herbal supplements may affect medications' effectiveness or have side effects.
More than half of Americans say they take dietary and herbal supplements, including ginkgo biloba, ginseng, or St. John's wort. Up to 1 in 4 adults report taking supplements and prescription drugs at the same time, and many don't ask their doctor if it's safe. Our Dr. Narula is here with why the combination can be risky. Good morning.
Good morning, John.
What is the greatest risk here of this mixing or of not telling your doctor at all?
So for most Americans who are about to take their ginkgo biloba, as you mentioned, they're thinking that it's to enhance their health. They're thinking it's natural, it must be safe. They're not thinking about risk. But the fact of the matter is that herbal supplements are pharmacologically active. They're biologically active. So they can do things like change your blood sugar, your blood pressure, your cholesterol, promote bleeding. So the idea that that could interact with medication also exists, meaning that if you're trying to treat a condition and now these herbal supplements have their own innate effects, you may be working for or against the condition you're trying to treat, number one. But number two, through kind of how they affect the liver and the liver metabolism, they can alter the amount of drug in your system to either make the levels higher of the prescription drug you're taking or lower.
Okay, so let's get specific. What types of these supplements can affect?
We're talking about things like St. John's wort, ginseng, ginkgo biloba, cranberry, green tea. There's a whole host of them. And so to give you an example, if you're a cardiac patient and you're taking a blood thinner like Coumadin, and then you're taking a specific herbal supplement, that could either make the Coumadin levels higher or lower in your system, which means you'll be maybe more likely to bleed, or that you may be more likely to clot. If you're taking a statin, you may be more likely to have muscle aches or pain. If you're a cancer patient on chemotherapy, it may not be as effective, the chemotherapy. If you're on antidepressants, it may make you more depressed.
I know, that was interesting. I think that interaction for a lot of people, because I think ginseng is very popular.
Yeah.
These are things that people don't often think about.
But why do you think patients don't want to tell their doctors that they're taking herbal supplements in the first place?
This is such a big issue. I can't tell you, 90% of the people I ask, they tell me that they are taking some form of a supplement, but it's only when I ask. If you look at the medication list, you say, what medications are you taking? They don't bring it up. And whether it's because they don't think that it's important or because they don't want the doctor to tell them don't take that, I'm not sure. But the reality is it's important because you need that open dialogue to discuss the pros and cons.
Are there any proven health benefits to taking these herbal supplements?
So we don't really have the data to support it. We don't have the science. And in this country, we don't get educated in the medical profession about it. But no doubt that there are probably some benefits, but you have to weigh them with the risks.
All right. And talk to your doctor.
And please talk to your doctor.
Please talk to your doctor. Thank you, Dr. Narula.